Good morning, everyone, and welcome to another edition of Commerce, the Senate Commerce and Labor Committee for the 81st Legislative Session. Madam Secretary, please call the roll.
Senator Hardy.
Here.
Senator Lang.
Here.
Senator Neal.
Here.
Senator Pickard. Senator Scheibel.
Here.
Senator Settlemeyer.
Here.
Chair Spearman.
Present. And please, Senator Pickard present once he gets here. And I'm not sure, we have a lot of feedback. Is somebody's mic that's open or looks like it's. So mark Senator Pickard present when he arrives, and I hope that he does. Otherwise, we won't have a lot of questions today. So Senator Pickard, if you can hear me, come on in the room. Welcome to our audience joining us remotely and anyone listening over the internet. Today, we have a hearing on Senate Bill 181 and 145. I would like to take a moment to go over some basic housekeeping items. As you know, the legislative building is currently closed as a public safety measure to reduce the spread and infection rate of COVID-19 public. And so all committee meetings will be held virtually, meaning committee members, staff, and everyone else will participate either through Zoom, video conference, or by telephone. However, there are various ways members of the public can engage with us and participate throughout the process. These include registering to participate through NELUS, where you have the opportunity to or provide public comment during the meeting. You may submit written comment to the committee email address or fax number listed on the agenda. You might also want to share your opinion via the legislative opinion application on NELUS or viewing committee meetings online through NELUS or on the legislature's YouTube channel. To register on NELUS, simply click the Participate button near the committee meeting, date, and time. Then fill in the required information such as your name, the agenda item you're interested in, and your position on the bill. Once your registration is submitted, you will see a confirmation screen, and you will also receive an email with the phone number and meeting ID to call at the time of the meeting. Just a note that while meeting registration is required to participate, it does not guarantee you will be able to speak. Similar to previous sessions, comment and public comment may be limited due to time constraints. I will announce the time frame, that is how many minutes we have for each segment, for, against, and neutral. It will be helpful if more than one person in your organization wishes to comment to remember that ditto is a good response when someone has already covered your points. This will allow more people to comment during the time frame. When you're on the phone line, please pay attention to which bill is being considered and follow the verbal prompts provided by BPS staff so that you know which keys to press to raise your hand and unmute yourself. Staff will call on you to speak by the last 3 digits of your phone number. Detailed instructions for participating in committee meetings are also available on the Help page, which is linked in the banner at the top of every page on NELUS. If you need assistance with any of these processes, or if you would like to receive electronic notification of the committee's agendas and minutes, please contact our committee staff at the email listed on the agenda. Any exhibits for the committee must be submitted in electronic format no later than 8:00 a.m. the day before the meeting to our committee staff. Contact information may be found on the committee page in NELUS. In addition, any person proposing an amendment to a bill being heard by the committee must first talk to the sponsor and let them know you intend to submit an amendment. I will not entertain any amendments if the bill sponsor is not aware of the amendment. The proposed amendment must be submitted in writing 24 hours prior to the meeting. Please include the bill number, a statement of intent, and your contact information. When testifying, please remember to unmute your microphone and clearly state your name and the entity you represent at the beginning of your testimony. Speak clearly and project your voice to ensure those watching remotely can hear your testimony. Please remember to turn the microphone off when you finish speaking. A reminder to all who testify pursuant to Nevada statutes 218E.085, it is unlawful for a person to knowingly misrepresent facts when testifying before a legislative committee. A person who knowingly does so is guilty of a misdemeanor. The chair and any member may request a testifier to submit documentation supporting their presentation. To committee members, during these virtual meetings, when an agenda item calls for a vote, our committee will be using roll call to do so. When the committee secretary calls your name, please answer with yes or no so that there is no confusion. Also, if you have a question, please raise your hand through the Zoom application. And finally, all exhibits received prior to the meeting will be available on Nellis online. And with that, let's please begin. We will open the hearing on Senate Bill 181. Senator Goicoechea, Ms. Sarah Adler, Silver State Government, and I think you have a couple more people here. So Senator Goicoechea, please begin when you're ready, sir.
Good morning, Chair Spearman, and it's my pleasure to be in front of Commerce and Labor this morning. I'm clearly not the expert on this bill, and that's why I do have the experts, Ms. Adler, Ms. Quillisi, and some of her people that are really responsible for delivering these services in rural Nevada, and we are truly struggling. So anyway, I am Senator Pete Goicoechea, representing Senate District 19, and I am bringing you Senate Bill 181. The version you see is the amended version, and we've been really struggling with the bill, and I know there was the last amendment that it was offered will show some changes again in the hours. We're really struggling with trying to facilitate licensure and have the ability to get these people in place in rural Nevada while not compromising any of the competency of the bill. So, and the training that is required. We really struggle across northern Nevada getting drug and alcohol counselors in place and maintaining them. It's truly a struggle. And although maybe we don't have the numbers, we definitely have the miles, and miles equate to time lost. And as these people do travel between, if they're on the road, they're not seeing patients, and truly is what impacts us. So the more of these we can have available and housed in our communities, the more of these drug and alcohol counselors we can have available and housed in our communities, the better the services we can supply. And given these very trying times we're in today, it's only exacerbating the situation. So with that, that's just a very brief, I won't walk through the bill because again, we have been tweaking and changing it, trying to get the best version we can. I know you've got a full schedule today, and I'm also supposed to be in Senate Finance. So we'll do the best we can, and we'd love to fix some of the issues in DMV on the other side. So with that, I'll stand for any questions right now, but clearly I am going to turn it over to the experts, Ms. Adler, Ms. Quillisi, and Caesar, and some of those people that truly understand exactly what the ins and outs, the questions you'll have, those technical questions. So with that, thank you, Madam Chair.
Senator Goicoechea, do you need to get back to finance right away, or will you be staying for the entirety of the presentation?
I'll listen in a little bit, but if you see me gone, amen, I skip back to finance, and I do appreciate that. And I thank you for your indulgence. It's that time of year where we're all bouncing around. And very nice to see your pickup downstairs in the garage this morning. Look forward to seeing you. Thank you.
Okay, thank you. Thank you. Committee members, if you have any questions for Senator Goicoechea, please ask them now so he can get back over to. Any questions? I don't see any hands. So with that, Senator Goicoechea, if you need to leave, you may do so now. And what we will do is we will get those who are presenting with you, put them on the hot seat if we have any questions. And if they can't answer it, certainly we will send in a written question and you can respond at another time. So thank you, sir. Thank you.
Well, thank you, Madam Chair. And if they can't answer it, you're probably wasting your time with me. So thank you.
Okay. All right. Ms. Adler, are you next?
I am next. Good morning, Madam Chair and members of the committee. My name is Sarah Adler with Silver State Government Relations, and I so appreciate Senator Gokachia, whom I've had the honor of working with, supporting rural Nevada for a very long time. We started with a disagreement over how we should invest CDBG dollars in rural Nevada, but we have overcome that. So thank you so much, Senator Gokachia, for your sponsorship of Senate Bill 181. Madam Chair, I'm now going to share my screen and bring up the PowerPoint. And we will begin to introduce you to the problem in rural Nevada and in all of our state that we are seeking to solve. So, Madam Chair, do you see my PowerPoint on the screen?
Yes, I do.
Thank you very much. So again, good morning, members of the committee. On behalf of 2 rural addiction treatment centers and certified community behavioral health centers, what we call CCBHCs, Vitality Unlimited based in Elko and New Frontier based in Fallon, I am pleased to bring to you Senate Bill 181 this morning. It is an honor to work with these organizations and to assist in this work. So what's the problem? Well, the first problem we're just going to look at very briefly is that Nevada, sadly, has a long and current history with Nevadans having substance use disorders. That's our modern word for alcohol and drug abuse or for addiction. The definition of it is there. I just want to point out that SUD, substance use disorder, describes both the use of illicit or illegal substances and the misuse of legal substances like alcohol, nicotine, or prescription drugs. We all have lived through we are still in the opioid crisis in Nevada. Fortunately, deaths and emergency room department visits peaked in 2016, but current data shows an increase in hospitalizations and deaths related to opioids in this last year, 2020. Again, we have seen an increase in drug-related emergency department visits from 2019 to 20, and sadly, a 26% increase in opioid-related emergency department visits. What I'm doing here is laying the groundwork for addressing the need for alcohol and drug counselors. Another drug that we struggle with here in Nevada is fentanyl. As you know, that is clinically prescribed as a very, very significant pain medication, but it has become a street drug. It has become on the street cut with heroin, very dangerous to individuals who misuse it. In fact, Southern Nevada Health District said there had been 63 deaths in the first 6 months of 2020 versus 28 deaths in the first 6 months of 2019. So another drug that we need to fight here in Nevada. And again, they're not, opioids aren't our only substance that we struggle with. Heroin ER visits were up. Sadly, in 2018, the CDC reported that Nevada had the highest amphetamine death rate in the nation. And then, of course, there is alcohol, long the drug of choice, and unfortunately, long a drug that is abused. So 2018, 2019 estimates tell us that 25% of Nevadans over the age of 12 said they'd engaged in binge drinking in the past month. And 6% said they'd suffered from alcohol use disorder in the past year. So just to give you 2 quick examples of the depth of this problem and the cost of this problem in rural Nevada. I, through my working life, have had a lot of opportunity to work with tribal communities in Nevada, and in talking with them about the opioid crisis, they said, absolutely, that's a problem, but have people forgotten about meth? Meth is a very significant problem in all of our communities, including our tribal communities. And then to the cost to local governments, I was for a long time the state director of USDA Rural Development. Churchill County took a very large loan from us to build a new jail, They had to build into that jail an intake room for people in drug crisis. And then the sheriff told me we used to use the women's side of the jail for overflow, men's overflow on weekends. Now we have to have a women's side of the jail because of the number of women who are arrested and incarcerated due to drug abuse and drug crimes. So very significant alcohol and drug problem. Now, here is something that I credit you, Chair Spearman, and your committee in doing a lot of work and helping us recognize in Nevada the breadth of mental health disorders that Nevadans are facing. And we see the three major categories listed here. Another term likely you are familiar with is co-occurring disorders or dual diagnosis. This means an individual that has both a mental health or mental illness diagnosis as well as an addiction or substance use disorder diagnosis. I put up on the screen there SAMHSA, which is really the federal leader in helping us do all of this work. Fortunately, we get a lot of money from SAMHSA, but really you, the legislature, are our similar body who helps us take steps to reduce the impact of mental illness and substance use disorders. So let's turn to Nevada and to what we call, as you know well, our behavioral health professions. And we've got 4 chapters. 641A governs psychologists, 641 psychologists, 641A, marriage and family therapists and clinical professional counselors are together. 641B, social workers, and then 641C, alcohol, drug, and gambling counselors. Psychologists have a different level of education, so I'll be speaking about the other 4 professions as our behavioral health professions today. I want to give you a little more introduction to licensed alcohol and drug counselors. At this time in statute, to become licensed as an alcohol and drug counselor, it requires a master's in a subject that the Board of Examiners approves as appropriate. When licensed, having taken the exam and passed it, paid your fees, an LADC can treat individuals with substance use disorder, or they can treat the SUD component as part of a treatment team of an individual with co-occurring disorder. The neighbor to LADCs, what I really consider to be the gold standard of necessity throughout Nevada and in rural Nevada, is the licensed clinical alcohol and drug counselor. Now, this individual's master's must have included comprehensive coursework in clinical mental health, including the diagnosis of mental health disorders. So they have high-level education on the mental illness side. So an LCADC can treat an individual who simply is suffering from addiction, or that single professional can treat individuals with co-occurring disorders. So a very valuable professional. Here's some good news. Thanks again to a lot of work at the legislature, the stigma around mental illness is lessening. As a longtime leader of NAMI in Nevada and 40-year family member of a sister I'm very proud of, who lives with mental illness, this is great news. The bad news is that LADCs and LCADCs are losing some ground relative to the other 3 behavioral health professionals. And unfortunately, that ground is lost in the pay that they can command out there in the field and in the profession. So this results in a lack of professionals to treat those addictions that are still very prevalent, very harmful in Nevada, and co-occurring disorders. So that's our bad news. Now let's look at the numbers across the licenses. These are numbers from 2014 to 2020. And talking about accuracy of information, Madam Chair, you spoke to earlier, these reports all came from Occupational Licensing Board reports to the Nevada Legislature. I do not guarantee 100% their accuracy, but they came from you. So thank you. So we look at the numbers and we see, for example, that In 2014, 19% of the behavioral health professionals were alcohol and drug counselors. We're down to 10% of those professionals today. We've actually lost 67 alcohol and drug counselors during the last 6 years. Now, again, some good news, we've gained 662 licensed clinical social workers who are absolutely awesome individuals. We've gained MFTs, we've gained CPCs. Fortunately, we've gained LCADCs as well, but you can see we have a real need to revitalize our alcohol and drug component. So what are some of the factors that are driving this? Well, working with my clients, we feel that really it comes to a matter of historical origins. Well, you see the big reason there. After your education, to enter these professions, you need thousands of hours, supervised hours, where you are working and being paid at an intern level, and you have a supervisor who is supporting you. So we think, and you see the difference, 3,000 hours in the other behavioral health professions, 4,000 hours for the alcohol and drug professions. How did this happen? Perhaps it's historical origins. In Nevada, we started to license problem gambling counselors many, many years ago, and these folks could enter that field with a high school education and then some training. Similarly, we certified alcohol and drug counselors many years ago with an associate's level of education and then training. In 1999, the statute was modernized to require that to become a licensed alcohol and drug counselor or an LCADC required a master's, but the hours of supervision stayed at 4,000 hours. Now, what's the consequence of this? There are many. So if you are an intern seeking, an individual, wonderful individual seeking to go into this behavioral health and addiction work, if you want to become an LADC or an LCADC, you have the burden of finding 1,000 more hours of supervised internship, of finding the supervisors, and you may even have to pay for that supervision yourself. Fortunately, my clients, when they hire an intern, they pay for the cost of the supervisor. But that's a lot of work to find 1,000 more hours of supervised internship. 1,000 more hours is 6 months of pay foregone at a licensed professional rate. So an LADC, Vitality starts an intern, a CADC intern at $15 an hour, pays a licensed LADC $24 an hour. That's their starting rates. That's $9,000 that you have foregone over 6 months. So that's a big deterrent to entering this field as opposed to the other behavioral health fields. Good news again, done a great job reducing stigma on mental illness, training more folks that treat the mental illness side. The result of this is we're attracting fewer interns to the alcohol and drug field. We have fewer supervisors available for LADCs and LCADCs. What is the result? Well, we're facing it across Nevada. We have so much untreated substance use disorder and so many Nevadans with co-occurring disorders that are not yet receiving the treatment that will allow them to be healthy individuals, to help their families feel successful, to reduce government costs, as I described in Churchill County, and then the societal costs of not having a healthy workforce. So what are we seeking to do about this? SB 181, actually, the language looks a little confusing, but it makes some simple changes. In Section 1, we take the required hours for a licensed clinical alcohol and drug counselor from 4,000 hours to 3,000 hours of supervised internship. We require that, and this is in today's amendment that's posted on Nellis, we require at least 1,500 of those supervised hours for an LCADC are with individuals with mental illness who also have alcohol and other substance use disorders. So that's our co-occurring individuals. At least 1,000 hours with individuals with alcohol and substance use disorders because, of course, addiction is a big issue in Nevada. And then for some flexibility, especially thinking about our rural workforce where finding supervisors is challenging, for some flexibility, that remaining 500 hours could be either with co-occurring individuals or folks with addiction. Over here in section 2 for alcohol and drug counselors, we simply changed that 4,000 hours to 3,000 hours to gain equity with the other behavioral health professions that also have master's degrees. And their supervised internship is with individuals with a diagnosis of substance use disorder. Now, that could be hours with a person who's SUD only, or it could be part of a treatment team treating the addiction portion of an individual with a co-occurring disorder. So a couple ways to get those 3,000 hours. There are 2 other changes in the bill. As we saw, there are very few LCADCs relative to the entirety of our behavioral health workforce, which is much smaller in Nevada than it needs to be. Right now in statute, to get those supervised hours as an LCADC intern, your supervisor has to be an LCADC, and that is way too narrow. We have all of these other licensed professionals who can appropriately supervise interns when they're working on the co-occurring side or on the alcohol and drug side of their required hours. And then finally, over here on the right-hand part of the slide, in the statute, you'll see that there is what we call an alternative track to licensure. And that takes an individual already licensed as an LCSW or an MFT or a master's level nurse and allows them with just 6 months of supervision to become an ADC or an LCADC. For some reason, and I think it's just an oversight, in this alternative track, clinical professional counselors are not included in that list to fast track to become an LCADC, yet their counterparts, LCSWs and MFTs are. So we're putting clinical professional counselors in, again, increasing the opportunity to get to our gold standard, in my opinion, of LCADCs. So there's the bill presentation. There's my summary on the top of the screen. I thank you so much for this opportunity. Next, you're going to hear testimony from my 2 bosses who are in the Zoom room or on the phone, Esther Quillisi and Lana Robards. And then finally, we will all be able to take your questions, assisted in responding to your questions by the fact that Agata Goronsky, the executive director of the Board of Examiners for Alcohol and Drug and Gambling Counselors, is also with us on the phone. So with your permission, Madam Chair, I will direct us next to Lana Robards, CEO of New Frontier.
Just before we get started, we may have to pause this hearing and go to the next hearing because one of the testifiers has got to leave at 9. So if I say, let's put a pin in it, it will do that and then we'll come back, okay?
Okay.
So who's next?
Lana Robard, CEO of New Frontier. Lana, if you'd unmute yourself.
Thank you, Madam Chair and members of the committee. My name is Lana Robards. I'm the director representing New Frontier from Fallon. New Frontier will be celebrating its 50th birthday this July, so it has been providing services to rural frontier Nevadans for a very long time. There are more Nevadans needing treatment, numbers far greater than we have seen before. Providers are getting hard to find, and yet we need more to provide the services that families need. Recruitment in rural Nevada has always been difficult, but it is getting harder with the lack of providers. Alcohol and drug counseling has a very long history in Nevada. beginning when there were people in the field without a high level of education. As these clinicians and their licensing evolved, so did the educational requirements for each level of certification or licensure. Behavioral health licensing, such as licensed clinical social workers, are more recent, so clinical supervision hours required were developed commensurate with their education and require 3,000 hours of clinical supervision. Licensed licensed drug and alcohol counselors, LADCs, and licensed clinical alcohol and drug counselors, LCADCs, also require a master's level education, and we request that that be taken into consideration when the committee considers this bill. New Frontier joins Vitality Unlimited as one of the first 3 providers in Nevada to become certified community behavioral health clinics, CCBHCs. As such, we provide a complete compendium of wraparound services to our co-occurring clients and their families. We need LADC and LCADCs to carry out our mission of providing behavioral health services to all rural Nevadans. In support of this bill, we would respectfully appreciate the committee's consideration. And I thank you, Madam Chair, for allowing me the opportunity to speak today.
Thank you. Who's next?
Esther Quillisi with Vitality Unlimited.
Morning. Morning, Chair Spearman, committee people. A special greeting to our Senator Goygachia. If you're still here, thank you so much for the support we get from you in all things. My name is Esther Quillisi. I have been with Vitality Unlimited since 1984. I'm the Chief Executive Officer and serve also as the Chief Operations Officer. I am an LADC and have been such for over 30 years, and I am a clinical supervisor for interns. Vitality Unlimited, if I may give you just a brief overview of who we are, serves the state of Nevada. Our treatment centers and clinics are located in rural and rural frontier Nevada. Vitality Unlimited is a nonprofit federally recognized 501c3 corporation with a long successful history of providing community services, affordable housing, high quality substance use disorder treatment, and access to behavioral health services. We are in our 50th year also. We started in 1971. Vitality Integrated Programs was added to our continuum of care for substance abuse and mental health clients to include bilingual services, pet therapy, transitional low-income affordable housing for families, seniors, and homeless veterans in Sun Valley, Nevada. I am here today to urge passage of the modifications for SB 181. Why? Because Nevada needs it. We are finding it very difficult to add to our workforce of professionals. We're all aging. And we've hung in there for a lot of years, and I have seen a lot of changes. And what we need is an impetus to support this very valuable specialty. And you know, you may be asking yourself over time, what's happened? Why has the specialty receded? Because I think there had been a movement nationally to say, okay, we're moving towards more mental health and mental health wraparounds. Well, what you're going to find is some of these mental health specialties, LCSW, MFT, don't want to treat addictions. They want to treat a component. If it's a co-occurring, they'll treat the component of mental health. If it's strictly mental health, then certainly they'll focus on that. But we found in our practice is that they'll say, oh, turn it over to the specialist. Well, that specialist is an LCADC or an LADC. We've got to again promote that, and we Vitality have promoted it by trying to attract clinicians, paying higher wages, making the work environment conducive to good treatment, both in our treatment centers and in our clinics. I mean, we're located in Elko, Carson City, Dayton, and Sun Valley, Nevada, and Reno, Nevada. We also think it's good for business. If we can help Nevada get off the floor, I mean, we're 51st in behavioral health care, and we are working diligently to raise our profile nationally. And I think the CCBHCs, which are not your typical outpatient clinics, I mean, we provide 9 core services, we do wraparounds, and we're an integrated system. We also provide to the people that come to our clinics primary care. And that is an important thing because we can address the whole person in the clinics that we run or the treatment centers that we run. And the same with Ms. Robards at New Frontier, because that's what the CCBHC model, which you've all supported over time, has brought to the state of Nevada. We want to remove the barriers that we can determine for any professional coming into Nevada. Why? Because it's good for business. It's good for us. It's a healthier Nevada if we can address the mental health and addiction concerns of our residents. And we want equity. And I think this bill moves towards that aim. We want it to be equitable across the professions. There's no reason why a master's level substance abuse counselor should not make as much, or it should cost them more to get it. And I think that we are working and will continue to work with Sarah Adler, who's been a great partner for us in working through issues in Nevada. And I know it sounds a little bit far reaching, but my concern too is how substance abuse counselors, therapists are treated even through federal payment systems. And that's going to be a big fight. So thank you. I know I think I'm going on too long. Thank you so much. If I can answer the questions, I'll be here.
Thank you so much. Ms. Adler, do you have anyone else that's presenting?
We do not, Madam Chair. Thank you very much. We stand ready for questions.
Okay. Committee, if you all can do me a favor, if you all can hold the questions. We have one of the, Dr. Tyler's got to leave at 9 o'clock, and I want to make sure that we get her testimony on the record as well. Here's what I'm going to do. I'm just going to pause for about 5 minutes and let Dr. Tyler enter her testimony on the record so that we don't hold her up from the next meeting. I don't know how long or how many times this has been done, but if this is the first one, we'll work this so that we can make sure that we hear our testifiers. So I'm going to pause the hearing on Senate Bill 181 and open now the hearing on Senate Bill 145 dealing with Reinvestment Act. And this is an act where banks submit what they've done to the FDIC, and they're graded on how well they have worked with the community to interact with the community. So, Dr. Tyler, can you begin now and just get your comments on the record?
Good morning, esteemed chair and members. Thank you for this opportunity to testify regarding SB 145. My name is Dr. Tiffany Tyler Garner, TIFFANY-TYLER-GARNER. I have the privilege of serving as the executive director for the Children's Advocacy Alliance, a statewide, nonpartisan, independent child policy advocacy organization, where a core part of our work is ensuring or supporting data-driven policymaking, resource allocation, and human services. And it's from that place that I'd like to speak about the importance of this proposed legislation. The Community Reinvestment Act was established in 1977 to encourage financial institutions to invest in the places where they do business, including low to moderate income neighborhoods. With that said, I want to affirm our support of this legislation from a few vantage points. One, the requirement to ensure that they report on these investments allows us to further contextualize the investments that are happening in Nevada, including in communities that are characterized as low to moderate income. As we attempt to unpack and address the social issues that we are facing, whether it's the fallout of the pandemic or a number of economic and social issues that were happening long before the pandemic ever happened. So you're hearing one today about the need to invest in our mental health system and the practitioners that do that work. Having a way of capturing or individuals formally reporting out on the investments they are making in Nevada's communities become a critical part of not only the asset mapping that we support that allows us to make informed decisions about how to allocate resources, but it also has several other benefits, including facilitating public and private partnerships, being able to identify institutions who have committed to certain aims in terms of investments in communities, and informally partnering with them because you're able to identify the level of investment or the quality of it becomes even more critical. And I speak not only from the vantage point of the value of capturing data or data collection or mapping, but also as a nonprofit administrator who has, over the course of my journey here, recognized that this notion of investment around social issues truly is an ecosystem. And so while there's been much discussion about the continuing need for more or deeper federal investments, recognizing that there are other entities, stakeholders, or players that also contribute to those investments, and routinely receiving a report about those can be incredibly helpful as we not only craft solutions to respond to the issues that we face, but also in terms of sustainability. From that vantage point, there's also the value of being able to articulate and have a report on these issues in terms of attracting national and other investments as a part of that work. So our ability to say as a part of our philanthropic ecosystem here in Nevada, that we routinely have a number of financial institutions that are investing in low to moderate income communities or neighborhoods that are even ranked or scored or valued or their investment is articulated, also gives us the ability as a state or entities that contribute to these social issues to articulate the ways in which others should invest because of the ways in which these institutions are investing. And then beyond that, the importance of recognizing those investments. So if we periodically received a report or there was some indication of where folks are investing and the quality of that, even the ability to affirm that that's the right thing to do because we are one state, a large community with many needs would be helpful. And so with that said, I want to formally note for the record our affirmation or support of this important legislation. Hope that you will consider the power and impact it will have for asset mapping, facilitating public and private partnerships, attracting national and other investments, as well as the recognition of doing great work towards helping us mitigate a number of pressing social issues that have been longstanding and those that are even emergent. Thank you.
Thank you, Dr. Tyler. Before she leaves, committee members, any questions for Dr. Tyler Gardner? I'm sorry, I knew her before she got married, and it was a long time. But anyway, Tyler Gardner, I want to respect your status now and respect your husband. So, committee members, yes, Senator Pickard first, and Senator Settlemyer.
Thank you, Madam Chair. Just one quick question. I'm wondering if you could define asset mapping for me a little more. I'm not sure what you're driving at.
Oh, no worries. Thank you, Chair, by way of the chair. So asset mapping is typically a reference to a research or a methodological approach where you look at the landscape or context and see and note where there are specific assets or investments. Some examples of asset mapping, if I was to tie it to an issue like addressing food insecurity. If I was asset mapping there, I might ask myself, where are all of the pantries across our state? What is the nature of the food service that they're providing? At what volume or amount, and to whom? If I was doing that maybe in a food desert, I might be asking myself, well, what grocery stores are there, or small markets that's a part of that resource? If I was doing it in the case of mental health, you might have gotten a snapshot like you received about the number and nature of practitioners in terms of the assets or resources we have around our mental health issues. So it's really a research reference to being able to map out like what resources we have in particular areas. So in the case of this discussion, what I'm suggesting is having that formal reporting where someone is indicating like the nature and amount that they have invested in communities as a financial institution, particularly around the discussion of low to moderate income as it relates to the work that we do at the Children's Advocacy Alliance, would be incredibly helpful, because it could help us frame or even refine how we talk about the need and response in our community. So leveraging this data, I might say something like, over the course of a 3-year period, approximately 42 financial institutions in 7 counties across Nevada, on average, invested blank amount of dollars towards the following areas. And as a result, we see this impact. So as we think about what our assets are, treating it as an ecosystem, it may be a certain number of banks who consistently invest in low to moderate incomes. I hope that wasn't
No, that's
too
perfect.
much
Thank you.
content.
I just wanted to make sure I understood, because that's what, how I, and I typically have referred to it as resource mapping, but I wanted to make sure we were talking
Yes,
the same thing. So
one and the same.
Yep, thank you.
Thank you. Thank you
Thank
for the
you, Dr.
question.
Tyler. I'm sorry, Dr. Tyler Garden. We're going to go now to Senator Settlemyre.
Yes,
Settlemyre.
Senator Sotomayor, pleasure.
Thank you, Madam Chair. I appreciate the ability to ask a question. I'm not sure if Ms. Tyler is the best person to ask a question of, or you, the sponsor, or someone else. But as I'm reading what the bill is trying to do, it seems that these reports are already made publicly available on the FEIC website. So how will this necessarily help Nevadans by doing that, since the reports are already available?
Senator Settlemyre, that's a question to ask me once we get into the bill, and I can explain that.
Okay, then I guess I'll wait. Thank you. Thank you.
Mm-hmm. Okay. Seeing no further questions, Dr. Tyler Gardner, certainly want to appreciate your indulgence, and thank you for stopping by. And I think we have done this in enough time to allow you to get to your other meeting.
Yes.
9 o'clock. So thank you so much.
Thank you.
Okay. Mm-hmm. And so we will put a pause in Senate Bill 145 and go back now to Senate Bill 181. And I think we're at questions. Any questions, committee members? Senator Hardy.
Thank you, Madam Chair. When we're looking at these requirements for licensing in Nevada, are we moving towards a more inviting state so that other states may have more, I'll call them onerous requirements, or are we doing it in such a way that we're opening up the borders so we can get more people in Nevada? Are we going to be, is there a common organization nationally that requires so many hours of supervision? Are we going to be able to allow these people to have their national certification requirements done as well as the state? So those are the kinds of things I'm not sure, where we're going. I obviously want to make Nevada more inviting. I don't necessarily want to make it at the expense of somebody who's not allowed to practice anywhere else, but we do need to make Nevada more inviting, and I appreciate this particular bill and looking at how we can do that.
Thank you, Senator Hardy, for the question. Through you, Madam Chair, to Senator Hardy, I will begin and then I'll ask Agata to contribute. Senator Hardy, the first issue we're facing is the economic inequity of within our own state, the Nevadans that we're trying to grow up to join in providing these critical services to Nevadans. Right now, there's a real economic barrier to choosing the alcohol and drug lane, if you will, versus the other mental illness lane. So that's the first problem we're trying to solve. I will ask Agata Goronsky to chime in on her level of knowledge about at the national level, how might this compare? Agata, you are there. Unmute.
Good morning. Can you hear me?
Yes.
Good morning. Agata Goronsky, Executive Director for the Board of Examiners for Alcohol, Drug, and Gambling Counselors. Senator Hardy, to answer your question, I think we're kind of overlapping the reciprocity issue here. And I'm not exactly sure that this bill in particular would address that issue. It's been and to answer your other question, there is no national requirement for the supervised hours. We do, however, have international credentialing and reciprocity consortium, which we are using for testing and credentialing. So if people are coming from other states and they have that credential, that we will accept the original scores and we will license or certify them in Nevada. Granted, they are meeting still our requirements. It is not that easy. Nevada does have a higher educational requirements when it comes to credentialing alcohol and drug counselors than most of the states. So that would require legislative changes within NRS 641C to do. However, at least this bill, I think is a first step in a right direction to open it up a little bit and make it easier and also more equitable with other mental health professions. Thank you.
I guess that's my point, is if there is no national standard and we can do whatever we want, then why wait at the first step? Let's open it up. Let's do what we can do legally and get them licensed in Nevada without making more steps that are going to get in the way. I want to make Nevada inviting, and I think this bill will do something, but I don't know what it is. I don't know how it conforms with other places. Obviously, we want to have people who are trained. At the same time, we want people. And I think the desperate nature of our situation requires us not to stop at a first step. That's my opinion. I love what we're trying to do, but we want to make sure we do it. Thank you, Madam Chair.
Thank you, Senator Settlemyer.
Thank you, Madam Chair. I had a quick question to start off with, because, it's pretty telling the amount of increase we've seen due to opioids. What's the increase that you've seen potentially with alcohol around the state of Nevada? I only have my anecdotal stuff talking to my counties that have seen significant increases in alcoholism due to the pandemic. People being locked up at home. The result has been rather sad what has been done. But I was wondering if you had any actual information, because I only know the data from my surrounding counties.
Madam Chair, through you to Senator Settlemyer, we certainly appreciate it.
Just go direct. Just go direct.
Okay.
To the members. Yeah.
So, Senator, I do not today have good statistical data on alcohol abuse, DUI arrests, other data that would indicate that, but I will work to gather that and bring that to you. I appreciate your recognition of this. In my own family history and tree, my Uncle Chuck, he left us way too many years early because of an alcohol addiction that was not able to be treated. So we'll get you that information. Thank you.
I appreciate that, Ms. Adler. The anecdotal stuff from the police departments that I've talked to in my areas is it has gone up. It's interesting that you would have thought that with the bars closed, it may have gone down, but sadly, certain individuals, rather than going to the bar, becoming inebriated and driving home, were at home inebriated, then went to the local store to acquire more. That being said, discussing what Mr. Hardy said, I was curious if you might have any information. I support the bill, whatever we can do to get more counselors in the area. And so my question is, what do the surrounding states require as far as hours? Are we putting ourselves, as far as the hour requirement, out, making other people not want to come here potentially to this state? Or what could we do while maintaining the same level of quality? Is there anything we can do as far as looking at those hours to be more attractive to individuals while not going below a level that would unfortunately cause problems?
Again, Senator Settelmeyer, what you are saying is music to the ears of everyone associated with SB 181. My clients have a deep commitment to improving this situation. So I again commit to you that we will gather some of that comparative information. I don't know if this session is going to allow us to amend in some additional improvement measures, but we will be back. We appreciate your encouragement and Dr. Senator Hardy's encouragement in this direction.
Okay, thank you.
Thank you, Senator Settelmeyer. Any additional questions? Committee members? Okay, I don't see any other hands up. So what we'll do now is let's go to public comment. First one will be in support of Senate Bill 181, in support of Senate Bill 181. And what I'd like to do is take 20 minutes for each and 3 minutes per person. And if someone has already said what you want to say, you can state your name, spell your name, and then say ditto. We want to get as many people in to have the opportunity to testify as possible, okay? So broadcast.
Thank you, Chair. To testify in support of SB 181, please press *9 now to take your place in the queue. Caller with the last 3 digits of 500, please slowly spell and state your name for the record. You have 3 minutes and may begin.
Good morning. This is Helen Foley, Helenfoley. Thank you, Madam Chair Spearman, for having this bill come before you today. Many of you know that for about 20 years, I represented the marriage and family therapist. Today, I am representing FirstMed Health and Wellness, which is an FQHC in Southern Nevada. Many of the FQHCs use dental as their secondary service, but FirstMed has taken on mental health as its secondary service, and it has thrived. Between 1 October and certainly with this pandemic, it is a crisis level in Southern Nevada. We have 23 mental health professionals that work with us. We are an FQHC and a CCBHC, so we also serve an awful lot of children in Southern Nevada with mental health issues. Out of the 23 individuals we have working with us, 7 are alcohol and drug abuse counselors. We could certainly use a lot more. Now, it's interesting that with the MFTs, a lot of them have a secondary specialty in alcohol and drug abuse. But we need a lot more. And I started working with Maggie Carlton when she was over in the Senate, when we had problem gambling counselors, and then the next session, alcohol and drug abuse counselors, be elevated to the level of mental health professionals. The one thing that we have to have is we have to have a master's degree. We have to make sure that there is a specialty in mental health, and then whatever their their specialty is after that, and supervision. These should not be off kilter. There should not be more hours required of alcohol and drug abuse counselors, especially the clinical, than there are for the other mental health professionals. As far as the direct language in the bill and how to allow greater reciprocity, that might come a little bit later, but we wholeheartedly support, First Med wholeheartedly supports the efforts of Sarah Adler and her team, and Agata, who I have worked with for many years in a cooperative fashion, to bring more mental health professionals into Nevada. And we thank you very much for your time and consideration today.
If you just joined us, we are currently in support of SB 181. To testify in support of SB 181, please press *9 now to take your place in the queue. Chair, you have no more callers in support at this time.
Thank you. We'll move now to opposition.
To testify in opposition of SB 181, please press *9 now to take your place in the queue. Chair, you have no callers in opposition at this time.
Okay, so those who wish to testify neutral.
To testify neutral on SB 181, please press *9 now to take your place in the queue. Caller with the last 3 digits of 570, please slowly spell and state your name for the record. You have 3 minutes and may begin.
Good morning, Madam Chair and members of this committee. My name is Leah Case, Leacasse, here today in neutral on behalf of the Nevada Psychiatric Association. We just wanted to express our sincere gratitude to Ms. Adler for reaching out to us, to the psychiatrists for their input on the training standards in the mental illness and substance use space. We support the complete spectrum of mental and behavioral health care and appreciate her efforts to get everybody on board here today. Thank you, Ms. Adler, and we will talk soon.
Chair, you have no more callers neutral at this time.
Okay, thank you. Committee members, additional questions? Senator Pickard.
Thank you, Madam Chair. Not a question, just a quick comment. As a co-sponsor of the bill and having been involved in this community, in the recovery community for about, well, a little better than a dozen years, I feel pretty strongly about this. I agree that we should be lowering the standard requirements for hours to match or maybe even compete better with our neighboring states. These people have a lot of great experience. They've already received their master's degree, and it would certainly be a boon to Nevada if we were to adopt these measures and get these people in. We desperately need them, particularly after the experiences of the last 12 months. So just want to lend my support and offer any help that may be needed. Thank you, Madam Chair.
Thank you. I have just one question. You may have already answered that. Ms. Adler, I think you said you don't have the exact data on the number of cases of alcoholism, whether they increased or decreased. So do you have any indication about, because opioids been around for a minute, has that gotten worse or stayed the same, or do you know?
Thank you, Madam Chair. So the data that I was able to collect recently was in our charts. And is it good news or is it bad news? Our rate of opioid abuse is extremely high. It is across the nation, but in Nevada, it's extremely high. So since 2016, it's come down a little bit. We still have an enormous problem. And this is something I personally as the godmother of a young man with very severe co-occurring disorder, I'm personally very concerned that we are not being able to provide enough effective intervention on the alcohol and drug abuse side. That's part of why I'm passionate about this. So it's a little better in a terrible situation.
Thank you. That was a great presentation and very expansive. The one thing, though, that I didn't hear, I think we also acknowledge the fact that many of the addictive behaviors are not just physical, but there is a level of spiritual deficit there, and people are struggling trying to figure out how to be who they are or where they place in the universe or whatsoever. So have you all done anything with working with some faith-based communities? And I'm not talking about for proselytizing, but working with them as another aspect of helping to treat the addictive behaviors, especially those co-occurring ones.
Madam Chair, I do not myself have knowledge of that. If my bosses from Vitality New Frontier wish to add to that, please do.
I'd like to comment. As you well know, one of the recognized evidence-based practice is the 12-step program, albeit view it as you wish. We're highly supportive of it. And at this point, we are working here in Elko with local ministers to not only provide benefits in food and clothing and shelter and some small stipends, but it's also, it's collaborative. So I'm glad you asked that. And I would like to add one comment anecdotally. What we've seen here in Elko since the COVID began a year ago, alcohol is always part of the addiction process. I mean, if some addicts can't get, for instance, the opioids, and they turn to alcohol because it's a depressant. But methamphetamine addicts, I mean, when they come down, they drink because it helps ease the crash. We've noticed here in Elko that we've gotten more overdoses of alcohol. I mean, highly intoxicated, physical problems. And so I can tell you that personally, because we've seen that. We've had to refer alcohol overdoses to the hospital more often, even though we can handle most detoxes. We've seen severe alcohol problems. And we determined that it has come as a result of the added pressures. And it was interesting that the senator said, it's kind of reversed. They go to the bars to drink when the bars close. Hey, you're an addict, you go drink at home. And then you just go find your supply at the grocery store. And that has been one thing that we've heard anecdotally, that, more sales occur in the grocery stores now. But our bars are opening up here in Elko County, and they have been. So I'm sure we'll see that again.
Thank you, ma'am. Can you state your name for the record, please?
Yes, I'm sorry, Madam Chair. It's Esther Quillisi, Vitality Unlimited.
Thank you.
Madam Chair.
Yes, ma'am.
Lana Robards from New Frontier, and I would also like to comment.
Yes, please.
Okay. Like Vitality, New Frontier supports 12-step recovery. We find a lot of strength in peers, helping peers. We also at New Frontier, because when our clients are out and running wild, they lose touch with some of the things that they were raised with, including their faith or their spirituality. And we work with all of our churches to work with individual clients if they're interested, to get them back into what they grew up with as far as their faith. We find that our clients they do better in the long run. Their length of their ability to stay clean and sober increases with the most peer support that they can get and the churches surrounding them as they do in a congregation. So I thank you all for the question, and I'm here for any more.
Thank you. I don't see any questions, so I just have, I guess, should say probably more of a comment. Although it wasn't stated explicitly, I know that when you treat an addict, you treat the family, because addiction is not in isolation. It is a part of a larger family unit. And looking at the family using genograms, you can usually try to identify where the breakdown happened or what's causing the presenting illness. So I won't ask that question, but Senator Settlemyer mentioned something about being shut down and going to the bars. And I think we answered that question. Here are a couple of things, though, I'd like to acknowledge. Number one, the COVID environment has taught us a different way of living, but it has also taught us a different way of dying. We don't talk a lot about that and the effect that it has on the entire family. And I said this in a previous meeting, but I keep hearing people say, you know, get the kids back in school, get the kids back in school, open up, open up. Well, we're doing that, but we have not mentioned the people that you all are treating are coming from a family. And if there are children involved in that family, even if they're not in the home, one of the things that we should be concerned about, if we're going to open schools, we need to make sure that we have social workers and some type of mental health and behavioral health support in the schools. And so open them up, but you're going to send the kids back, and they're dealing with the behaviors of the clients that you all are dealing with, and they don't know, they don't have the same type of equipment. So that always disturbs me. Every time we talk about mental health, you can talk about the person who's the client, but you cannot extricate them from the family, and not just the immediate family, but you have to look at the family from a genogram point of view. So my question would really be, and it may not be so much needed in the rural and frontier areas as it is in our more urban areas, but what about ethnic and cultural diversity? Because that too is important when you're treating someone with addiction, someone who the client can go to that has similar lived experiences, or that has some type of credibility with the client. And usually that comes, by looking at someone who, or working with someone who has the same ethnic background, not always, but many times, and who understands the cultural aspect of trying to fight the addiction.
Thank you, Madam Chair. If I might, this gives me an opportunity to bring up that we are currently working with the board on a remote supervision change to the NAC and 641C, particularly because of this issue. In rural Nevada, we do have ethnic, gender identity, all kinds of diversity, but it's hard to find the supervisor to help you learn how to do that kind of treatment. So one of the real important aspects of enabling remote supervision is to allow an intern to get some support from someone who might represent different cultural competence and understanding than that intern might have themselves. So this is totally on the radar in this side of the profession. Alcoholism probably presents differently in a large Hispanic rural community than it does in our typical rural Caucasian community. So this is something that this discipline is on, and seeking ways to become more competent.
Thank you. Thank you. And so with that, do you all have any closing statements? Have we covered everything? Is the whimpering?
We've done a great job. You all have been terrific in your endorsement of the work that we are doing. And I just want to give a final thanks to Senator Gocochea. Esther, Lana, and I were talking on November 25th about the challenges we're facing. And they said, there's this inequity in the hours. What can we do about that? And I contacted Senator Gocochea, and within an hour, he said, Sarah, send me something and let's see what we can do. So we have great appreciation for all of you and Senator Gocochea. Thank you very much.
Thank you. And so with that, we will close the hearing on Senate Bill 181 and would like to open the hearing on Senate Bill 145. And I will turn the virtual ballot over to our most capable Vice Chair. Vice Chair Neal.
Thank you, Madam Chair. All right. So we will go ahead, Senator Spearman, and start your presentation on SB 145.
Thank you.
Are you sharing the screen?
Thank you, Madam Vice Chair. For the record, I'm Pat Spearman, and I represent Senate District 1 in Clark County. I'm pleased to present Senate Bill 145 for your consideration, which relates to the Community Reinvestment Act, rating assigned to a financial institution based upon the way they interact with the community. When the Credit Reinvestment Act, or CRA that is normally known by, was enacted in 1977, it was intended to address certain discriminatory practices such as redlining. Since the 1930s, there has been overwhelming evidence that banking institutions, some have refused to lend to some members of their communities, mostly people of color in urban areas. They are seeking home or business loans. They are trying to get loans to do something else, but in many cases before CRA, the people in the communities where the financial institutions were not helping that community. In other words, they were taking money out, but there was no financial investment in the community. The CRA extends and clarifies the longstanding expectation that banks should and will serve the convenience and needs of their local communities and not discriminate in their lending practices. The goal of the CRA is to ensure that every insured depository institution, that's banks, savings and loans, et cetera, is meeting the credit needs of the entire service area. And that's low to moderate income individuals and communities in particular. Institutions can meet such credit needs in a number of ways, including originating mortgages to low, moderate, and income, also known as LMI borrowers, making loans to small businesses, supporting economic development, affordable housing initiatives, supporting some of the 501c3s that are working in the community, 501c3s, which are civic organizations, faith-based organizations, et cetera. Even with the CRA, though, we still see that there is a need, not just in our community, but across the globe. And what we have seen as a result of the pandemic is the need that was there before. Now it has been exacerbated, and you might say that the need is on steroids to the 25th degree, because some of the places that people in the community would go to for help, those organizations have been decimated or negatively affected by the pandemic. So our neighborhoods continue to be highly segregated based on race and income. Residential segregation has a substantial negative effect, especially for disadvantaged families who are disproportionately subjected to large interest rates, high interest rates, and subjected to other things connected with the ability to get a mortgage that makes them the least likely to be approved for a mortgage. I'm sure there may be some who are listening here today that trying to understand, wrap their heads around why do we need this and why is it important to make sure that we are highlighting our BIPOC communities. Well, I'm glad you asked that. There is a book that I would commend to you, The Black Tax, and that's by Sean Rochester. This is some of the things that he says in there. While Black Americans have long felt the devastating effects of anti-Black discrimination, they have often had great difficulty articulating and substantiating both the existence and the impact of the discrimination to an American public who is usually convinced that it no longer exists. That's why you hear things like the welfare queens. That's why you hear things like they're only going to use this to gamble. They're only going to use this for drugs, whatever, because many people in the dominant cultures do not understand the lingering effects of discrimination of Jim Crow, and even beyond that, where we are today. Professionals in academia, the media, and business community, along with people in the general public, have struggled to explain significant and persistent gaps in wealth, employment, achievement, and poverty between Black and white communities in what they perceive to be a post-racial America. In his new book, Sean talks about the Black tax, that invisible tax that everyone who is not just Black, but everyone who is in a BIPOC community experiences. The cost of being Black in America causes great financial distress. And it is unconscious for some, but it is a daily reminder for many others that being different, being a non-white individual, creates disparities in everything that we do, everything that we do. The CRA requires federal regulators to rate banks' performance and engagement in qualifying activities such as businesses, consumers, mortgage lending, and I've talked about some faith-based organizations, civic organizations, et cetera, and to make sure that the focus is not solely, but mainly on LMI communities. Banks with assets of 250 million or less are usually the ones that are rated like maybe every 4 to 5 years, depending upon the grade that the last grade that they got. There are 4 federal bank supervisory agencies, and that's the Office of Comptroller of Currency, the Board of Governors of the Federal Reserve System, the Office of Thrift Supervision, and the Federal Depositors Insurance Corporation that periodically evaluates financial institutions, their record to identify whether the institution is meeting the credit needs of its entire community. And I will note that most of the financial institutions, and I'll speak for Nevada, most of the financial institutions are doing their best to make sure that they're honest with their CRA activities. But we also know that there is no organization that is perfect and has perfect attendance or perfect participation. I use this example when I pastored a church, there were some people who sang in the choir in the alto section that really should have auditioned for the ushers because that wasn't their forte. And so even though you have most of the banks who are participating, you still have some who are not. Ultimately, the CRA is an important tool to hold banks publicly accountable and expand financial opportunity and equity to Black, Indigenous, and people of color communities, also known as BIPOC. Therefore, SB 145 will be a vehicle to educate Nevadans of the activities and investments of their local banks. I believe that making banks' CRA ratings publicly available will provide social pressures that they must avoid discrimination in their lending programs, and they will take steps to reduce historic patterns of discrimination and increase access to opportunities to those who have previously been denied. And if I can just take this moment to add, just before I ask for Pastor West to come on, Senator Settlemyre asked if it's available on the website. Why do we need this? Well, I'm glad you asked that, sir, because if you were to walk out of this building right now and ask 5 people if they knew what CRA was or what Community Reinvestment Act is, you would probably find maybe one who could tell you what that is. And so what this bill does is it is designed to talk about it, but also elevate the awareness that it exists for the community and for community organizations. It is also a way of saying here is another opportunity for those financial institutions who are already participating but want to make sure that they are doing even more as we try to pull up out of this financial abyss that has been caused by the pandemic. So it has a website, but everybody still doesn't know about it. What this is really designed to do is to raise the awareness. Very similar to everybody knows that there's a McDonald's someplace on a corner in every city, but they still advertise on TV. So it's really designed to raise awareness. And with that, I'm going to ask if Pastor Kelsey West would come and speak to you on behalf of Senate Bill 145. Pastor West is the pastor of Nehemiah Ministries in Las Vegas.
So good morning to Vice Chair, to Chair, and to those who are here. Thank you for allowing me to share this morning. I would like to be as transparent as possible with the time that has been permitted to me. Prior to learning about this bill, I was truly uninformed about CRA. I really was. I'm involved in our community. I work with a lot of different organizations, and I hear the talk, the concern about how we're going to maneuver and rebuild coming out of this pandemic, which has definitely affected all of us economically, but for some in some communities a little bit more than others. This bill, in my humble opinion, is very important because as I stand as a pastor and as a community leader, there is unfortunately a misconception. For many of us, we believe we are in relationship with banks because we have an account. And we do not find that relationship is not as strong as we need it to be until we apply for funding. And that's when we find out that the account, and despite the amount of money we may deposit on a weekly basis, does not warrant us the same opportunities as others. And so having such a bill like this as that would inform us, it would keep us engaged to more so help hold our financial institutions responsible to make sure that fair lending practices are being met across the board. Because as we prepare to come out of this pandemic, I do represent a community of people that are not looking for a handout, but who are really looking to move forward economically and to build as we move forward. So I do thank you for your time. I do plan moving forward to do my due diligence to utilize the research that's available, and I plan to do that moving forward. So again, I thank you for your time.
Thank you, Pastor. I might also say, even though it was taken out of order, you heard Dr. Tiffany Tyler Gardner talk about the importance of mapping our assets and mapping all the resources. There are some larger cities in the East and in the Midwest, Philadelphia and Cleveland come to mind right now, where they are actively engaging the financial institutions in a resource identification and the necessary things that need to happen. And together, community partners, along with the financial institutions, are deciding or making plans as to how they might help those communities that have been more adversely affected by COVID-19 than others. And so with that, I will stand for questions, try to illuminate further if there are still some people who don't understand why SB 1 is necessary. Thank you.
Chair Spearman, members, any questions on SB 145? Okay, Senator Pickard, I'm looking at the hand.
Thank you, Madam Vice Chair. I have always been intrigued with transparency issues, and this fits right in there. I thought, although I didn't look, that this sort of information would have been available. But if I understand correctly, there's no, is it true that there's no public access, there's no presentation, there's no way for people to find out an institution's CRA rating currently, and this would put that in place? And if so, are we the first in the nation to do this?
So let me answer the question this way, Senator Spearman, for the record. I think we heard Pastor West say that he did not know before this bill about CRA and that it existed. And that is probably true for about 90% of our community organizations, especially those that are helping members of BIPOC communities. There is a place you can go to the FDIC and you can dig through there and you can see what the rating is. But as I said before, this is another way for us to elevate the awareness so that people know that this exists. And it is also a way to serve notice to those who are not doing what they should be doing in their communities, that somebody's watching you. I don't know if we're the first in the nation to do it. Nevada has been first in so many different ways. First in resurrecting the ERA, first female majority, 2 sessions. We got a lot of firsts under our belt. If it is, then that's just, that's another first that we have, and people will soon realize that Nevada is a leader in so many ways. So the CRA, the 145, number one, elevates the awareness for people who do not know. Number two, it helps those banks that are already doing their part with the Community Reinvestment Act. And three, for those who are not doing their best, it also serves notice to them that someone is watching. And so this is not just a bill to waste paper. This is a bill to say, we need this to happen in our community. One of the things that I know that has happened since the bill has been introduced is that I'm getting a lot more calls from people in community organizations as well as pastors saying, so how do we find out this information? I didn't know, what is it used for? What can I use it for? And so the conversation has begun, and I think that it has begun in a very strategic time because as more people are vaccinated and we continue to wear a mask, there will come a time when we won't have to do those things that we've done for the last 18 months. And when we come out of that, there will still be communities that have been decimated. Let me give you an example, Senator Pickard. When I was in Texas and pastored a church there, when you walked outside the front door of the church, it looked like a wasteland. It was in a low to moderate income community. And there were vacant houses, there were lots with weeds that are overgrown, et cetera, et cetera. And one of the things that we did was we partnered using the CRA with the bank that was 3 blocks away from the church. We partnered with them to do a couple of things, to help small businesses get the money that they needed to go and clear out those weedy lots, so to help small businesses to get the money that they needed for those homes that were abandoned to bring them down and to clear that off. We also, because there were so many people who wished to have a home but didn't have access to that, we also conducted a 4-month, it was every weekend, and we rotated people in every weekend. It was Thursday, Friday, and Saturday. And it was a home buyer's workshop that taught people how to get your credit ready, how to make sure that you know how to fill out the forms, et cetera, et cetera. And for everyone who went through that program and was presented a certificate, the bank reduced their mortgage rate by 0.25%. Now that's huge for people who that's the first time buying their home. So I became very familiar with it in the 90s, but there are a whole lot of people who don't know.
Thank you.
Okay, Senator Settlemyre.
Thank you, Madam Vice Chair. You're so efficient. You always turn the mic on and off, and it confuses me because I'm not sure what I'm supposed to be doing myself. That being said, thank you for allowing me to ask the question. I'm curious, the CRA only affects banks. So there's other lending institutions that are out there, such as credit unions, payday loans, and things of that nature. Do you know what the percentage is that you'd be able to capture with this bill? What percentage of lenders are banks versus the other sources that will not be affected by the bill? So I'm just trying to find out that number.
So thank you, Senator Settlemyer. If you're asking for specific statistics on the percentage, I don't have that. I'm sure that we could probably ask research to get that for us. But again, I say those banks who are governed by FDIC, and they know who they are and are required to submit a report. Some are required every 48 months. Those that consistently get an outstanding, then they only have to report every 60 months. In terms of banks versus credit unions, I don't know what that means, but here's the other thing that I do. I know that in talking with the credit unions here in Nevada, I do know that they have been very involved in their communities, in the communities of, and it's not customers, but in credit unions, these are people who are also shareholders. And so many of them are already involved. If anyone is looking for a way to say, well, we may not need this because that is happening, then I would reject that statement. I will say again, this bill elevates the conversation. This bill elevates the awareness. Those who are already doing what they need to do in the CRA, and I don't know if Phyllis is on, but she will tell you that several of the banks here in Nevada are already doing it. And credit unions who are not a part of what the CRA was designed to do, many of them do it anyway because it's not customers, but they're shareholders. So again, this is designed to elevate the conversation and elevate the awareness. The percentages I don't have, but if that is important to you, I can get that probably by tomorrow.
Thank you, Madam Chair. I appreciate that. All I was trying to do is get a full picture of what's going on here. Thank you.
Thank you.
Okay. Thank you. Members, any additional questions? Okay. So, Senator Spearman, I know I just have one question.
Oh, God. You answered.
I appreciate that this is being elevated, but I'm also wondering, within business and industry, is there also a future goal or an idea to maybe have the agency start to educate on like the rulemaking and break down the recent changes that have happened with the CRA? There were, a series of states that challenged the rules in 2021 because the shift from the CRA actually giving, basically, instead of giving the dollar amount, we'll be doing the number of loans, and the amount that they actually invest in communities matters because you know exactly what's going where based on the geographic nature of the CRA, and you would know by census tract. So I'm just wondering if that is like one of your future goals to maybe start having a little bit more webinar integration of CRA so the community can access it, participate in the rulemaking, make comments, and then really deal with what's going on in the space.
Madam Vice Chair, I had not thought about that, but that is a very good suggestion, and I think it could probably be phrased as a friendly amendment to ask community organizations, those who have the capacity. And I talked with the president of the Urban Chamber about this, and he's aware of it and looking for ways to expand that and looking for ways to make sure that community organizations who may not know about this but also need help are put in contact with those persons who are doing it. So that's a wonderful idea, wonderful idea. I'd like to accept that as a friendly amendment, so that we can get the word out and so this information can be readily available to people. And I think it was the Bank of Philadelphia. I was just looking at my notes. I think it was the Bank of Philadelphia that started the process of, so the CRA has been working, but it needs to be modernized. And so they are actually doing some things, collecting information from the community as in terms of how can they bring what was in the 20th century, about mid-century, bring that into the 21st century so that it is applicable to the needs of the communities today. So I think the workshops are a wonderful idea.
Okay, thank you. I wasn't expecting an amendment. I was just asking. So
that's a good idea, and I want to make sure that we get it in there. And let me just say to those who are worrying if I just put something else on to the banks, I did not. Doing the workshops will be something that community organizations, now that you know, can ask banks to partner with you to do some of those workshops.
okay, thank you for that. All right, so we will open up for support for SB 145. BPS?
Thank you. To testify in support of SB 145, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 261. Please slowly spell and state your name for the record. You have 3 minutes and may begin.
Good morning. My name is Jillian Block, Gillian Block, speaking in support of Senate Bill 145 today on behalf of the Coalition of Legal Service Providers. This bill promotes accountability by ensuring that the SID, the legislature, and the public are aware of the progress that each financial institution subject to the reporting requirement has made in expanding access to low-income Nevadans. Historic inequities have limited these Nevadans' access to lending and banking services, and legal service providers see the consequences of these inequities as our clients fall victim to predatory lenders who have filled the gaps left by the absence of mainstream financial institutions. Many institutions have made progress expanding access to less represented groups, and this bill will help give them the credit that they deserve. Other institutions will get some much needed encouragement to think more inclusively and increase their efforts to reach out to historically excluded Nevadans. On behalf of our clients who deserve to have access to mainstream financial services, we support SB 145. Thank you.
Thank you for your testimony. Next.
If you recently just joined us, we are currently in support of SB 145. To testify in support, please press star 9 now to take your place in the queue. Again, if you recently just joined us, we are in support of SB 145. To testify in support, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 199. Please slowly spell and state your name for the record. You have 3 minutes and may begin.
Good morning, Chair and members of the Senate Committee on Commerce and Labor. My name is Tess Opferman, that's OPFERMAN, speaking on behalf of the Nevada Women's Lobby. It is a top priority of the Nevada Women's Lobby to support legislation that helps minority and low-income women and families, which this does. So we thank the sponsor for bringing this bill forward and ask for your support. Thank you.
There are no more callers in support at this time.
Okay. We will open up for opposition on SB 145.
To testify in opposition of SB 145, please press star 9 now to take your place in the queue. There are currently no callers in opposition at this time.
Okay, so we will open up for neutral for SB 145.
To testify neutral on SB 145, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 336. Please slowly spell and state your name for the record. You have 3 minutes and may begin. Caller with the last 3 digits of 336. Please press *6 to unmute yourself. You may begin.
Good morning. For the record, this is Phyllis Gergovich, PHYLLIS-GURGEVICH. I'm President and CEO of Nevada Bankers Association. Thank you, Chair Spearman and committee members for the opportunity to comment, and thank you to Senator Spearman for reaching out to us on this bill. As you heard, banks in Nevada are the only financial institution type, the only lenders that are subject to Community Reinvestment Act requirements and examinations. And as such, banks are very proud of the contributions they make to their communities, and they always appreciate an opportunity to share more information about their contributions. All of our members are proud to have satisfactory or above ratings. In fact, more than 1/3 of the banks in Nevada have outstanding ratings. Banks look forward to continuing to support their communities. Thank you.
Okay, thank you for that. BPS, is anyone on the line for neutral?
Vice Chair, you have no one left neutral at this time.
Okay, thank you for that. Senator Spearman, do you have any closing comments?
Yes, ma'am. I'd just like to say, and I neglected to say this in my opening testimony, but what the bill does, it requires banks, financial institutions who are required to submit information to FDIC, requires them to submit that same information to FID. There's no fiscal note because the only thing you're doing is transmitting electronically. And that is so that here in the state, we know who's doing what, and it also, again, allows us an opportunity to map our assets. There may be some who are really interested in making more home loans. There may be some who are more interested in doing after-school programs, whatever it is that they're interested in. You may have heard when we did the Divine 9 license plate, I believe it was last week, one of the things, the proceeds from the license plates are going to go to the United Negro College Fund. Pastor West is on the phone, and what he did not say about his organization is that, and I think it's for about the last 10 or 11 years, the church has been sponsoring on spring break a bus tour to HBCUs. They've gotten some help, but have not gotten a lot. Here's an opportunity for a bank who says, I want to do something in terms of investing in education. Here's a way for them to partner with this organization, and they can do so. I appreciate your time. I appreciate the questions, and even appreciate the amendment. Thank you all, Madam Vice Chair and committee, for your indulgence. Thank you so much.
Thank you. Okay, so we will go ahead and close the hearing for SB 145, and I will turn the meeting back over to Chair Spearman.
Thank you, but you're doing such a wonderful job. So we will go now to public comment.
Thank you, Chair. To speak in public comment, please press *9 now to take your place in the queue. Chair, your public line is open and working, and you have no callers at this time.
Well, thank you so much, and I want to thank those who were able to participate, and those who asked questions and those who answered. Thank you so much for everything that you've done. I want to thank Senator Gorkachia and Ms. Adler and their team for the presentation on mental health. So with that, we will adjourn this meeting, and we will be back on Friday the 19th. We are now adjourned.